Hey, everybody. Welcome back to the Outcomes Rocket. I'm so excited to have you back on the podcast today because I've got an extraordinary guest. You know, we're talking a lot about founder stories. That is the theme of our podcast now. Since we changed to this new theme, I've been meeting such great people. And one of those great people is Chris Cox. Chris is the co-founder and chief strategy officer at iVitaFi. He's an expert on financial services, healthcare, and fintech, and he leads product strategy and operations at the company. I'm excited to have him here on the podcast to talk about the work that they're doing to make healthcare more accessible and to help health systems with their money. So, Chris, thanks so much for being on the podcast.
Sure, thanks, Sal.
Chris, being that we're indexing here on the founder story, tell us about you. What is it that took you from doing what you were doing before and getting into entrepreneurship and healthcare?
Sure. So I actually started my career in the financial services world. So really having nothing to do with healthcare, and actually started working for a very large debt buyer, and saw just how many people were struggling to pay for their at this point credit card bills. And I did that for a couple of years, really running the analytics. And ultimately, I think by the time I left, I was managing a portfolio that was 40 or 50 billion in size. I mean, so just massive, massive dollars of people who can't afford to pay their bills. I then had an opportunity to go work for a private investment fund who was making investments into kind of esoteric industries. And that's when I really started to see the healthcare challenges. We were funding a company who was buying bad debt from hospitals, and they were paying like a penny or 2 pennies for the bills. And they were just massive, massive files with tons of patients. And I'm thinking, gosh, there has to be a better way. And we got a group of people together that had experience within this kind of specialty finance section of the industry. And we started digging around. And I was talking with a hospital CFO, and I asked him, hey, how much do you collect on your healthcare bills to patients? And he told me, we're doing really good, Chris. We're doing about 35%. And my jaw dropped. I'm like, that's not good. So that's really where the impetus for the idea kind of started and how we jumped in.
Well, yeah, man. I mean, and like billions of dollars, you were seeing this and pennies on the dollar, spreadsheets of patients. You're like, what is going on? That's healthcare right now, and it's terrible. And so accessibility is a huge issue. You wanted to do something about it. And as we think about this, the one question that I did have on the business is, are you guys focused on the cash paying side then, on non-insurance?
Actually, we do both. So oftentimes, and we'll talk about this, I'm sure, as the show goes on, but folks are more and more often enrolling into high deductible healthcare plans. So when you go to the doctor or the hospital, you're going to have, a $2,000, $3,000, $4,000 out of pocket that you'll have to pay for that visit, and that's with insurance, right? If you don't have insurance, now you're talking to the tune of potentially tens of thousands of dollars. But we focused really on both sides of the uninsured, underinsured, and the insured.
Understood. Got it. Thank you. That's good to know. And so help us understand how you guys are really helping unlock the revenue cycle for health systems and where you're adding value.
Sure. So if you think about kind of where healthcare was, I'm going to take a step back and do a little storytelling. So if you think back in like the 90s or early 2000s, around 90% of the financial burden of healthcare was being shouldered by the payers, the insurance companies, right? Well, then something unique happened. Well, there was the advent of the ACA and the really the popularity of high deductible healthcare plans really started to take off. And what that did is it shifted a lot of that financial burden over to the patient. So now we're seeing about 20 to 30% of the financial burden is supported by that patient. Why is that important? Well, these hospitals have built all of their systems, their technology, their talent is focused on the reimbursement of claims by the payer. And now they're finding that a large portion of the financial burden is now the patient, and you need a totally different strategy and approach to that. And that's really where we plug ourselves in, is helping these providers in collecting from their patient population in a means that doesn't, frustrate that patient. If you think about the current workflow today, they spend months and months and tons of time and people to try and collect, this 30 to 40 cents on the dollar, where you plug in us, where we're an embedded financing company, seamlessly integrated within the RCM workflow. You can almost think of us like a payer in some respects. If you enroll the patient into our program, we, cut a check to the hospital, for twice what they would have collected on their own without any of the cost. And that's kind of where we plug in.
Chris, yeah, that makes a lot of sense. And so are you guys, so then your company comes in, so iVitaFi comes in. Is it part of the enrollment? Like the patient gets admitted and it's part of the discussion, like, hey, what are you going to do about your deductible? Well, we have this plan. Go ahead and sign up. You catch it that early, or you catch it further downstream?
We do. And that was actually something that's kind of unique to our offering. We built our program with free service in mind, and being able to advance the discussion around the balance. Because I don't know about your personal experiences with the US health system, but we just had a baby in February, and
Congratulations.
Thank you. And you go through this whole process. No one brings up cost until you get a bill 45 days later. And it's like, gosh, there's a better way to do this. Bring that conversation forward and start communicating and setting expectations so that people understand that they will owe a balance and an estimate of how much it will be. And that's really where we see the vast majority of use for our program, is at that patient access point. So it could be done as early as scheduling.
Love it.
But we've trained the staff to offer it at registration. It could be bedside if it's in their emergency department, or post-service, through their typical billing or dunning statements.
Got it. Fantastic. No, it's great to know. And, it definitely is a great way for patients to be able to pay for these things, and for health systems to capture that collection up front. So you mentioned, right, one of the key differentiators that you guys do is sort of where you show up in the revenue cycle process. Anything else you want to highlight as things you guys do different or better than what's out there?
Sure. No, it's a good question, because there's lots of different patient financing options out there, and it actually took me some time to kind of understand and learn it all. So when you think about patient financing, it really started with hospitals offering payment plans. Payment plans have been around forever, and they're not going anywhere. The hospitals don't really love them because they're kind of a pain in the butt to administer and manage, if you're not specifically built to run payment plans. An example is someone's debit card expires, right? Well, that payment now broke, and now you've got to have someone to call them, which now you have a call center. So you have all these things that you're not purpose built to do that, right?
Yeah.
Recourse lenders came around in the 80s, maybe 80s, 90s. And basically what recourse means is that the patient takes out a loan through this lender. The lender will advance the funds to the provider. And so long as the patient makes their payments, everything's kosher. But if the patient runs into hardship and starts missing payments, the hospital actually has to hand the money back to the lender. And then the patient experience there is really wonky, right? Like, where does the patient fit into this transaction?
See, it seems like a bad deal.
Yeah. And if you think about it, economically, it's no different than a payment plan. Because once they stop paying, you have to give back the money that wasn't paid back. So it creates friction for the providers. So what we do is completely non-recourse, meaning it's what you typically think of as like a loan, right? We advance the money, and if they stop paying, that's for us to eat. And I think what really makes us unique is that our program is designed for everybody in mind. So we believe that everybody deserves access to affordable healthcare, and not just the folks with gold-plated American Express cards. So our approval rates into our program are north of 95%, and we never charge interest. We're a 0% interest company. Some of our competitors out there will offer promotional 0% interest, and then retroactively charge you interest if you miss a payment. We don't do any of that. It's truly zero interest.
That's pretty cool. That's pretty differentiated.
Yeah.
So then you guys just doing some rev share with the hospital on it then?
So basically what the hospital do is we'll go in and look at their data and say, hey, how much are you collecting from your patient population? And if it's, 30, 40 cents on the dollar, we'll go in and say, hey, we'll give you 70 cents on the dollar. So you can, basically.
So they're winning off the bat.
You're winning off the bat. You have cost reduction from the provider side because now they don't have to go chase after it. And they know that from the patient's perspective, they're placing their trust in us to treat their patient well. And we're never gonna, charge them interest or, we even pay their late fees from the bank. So we are definitely a patient first company.
Man, that's awesome. I mean, I was just assuming, right? I was thinking this, I wasn't saying it. I'm like, okay, cool. They must have some, I don't know where their interest rates are. And then you said this. So pretty, so it's like you read my mind. That's pretty cool, man. And that is a patient first approach. And I love it. And the other thing that I love is, from a provider perspective, you don't have these clawbacks. Like it's just like a really de-risk thing for the provider. It's an access play. I love it.
Yeah.
I love it.
Yeah, and
kudos, man. That's awesome.
Thank you. We've strived to make it as simple as possible, because when we were surveying the market, trying to understand the financial modeling of some of these recourse providers, it was really hard to understand, like how the money movement worked and the pricing mechanics worked. And I was like, guys, we just need to make this stupid simple, and that's what we've kind of aimed to do.
That's awesome. Wow. Cool. I love it, man. Great solution. For anybody listening, if you're in the rev cycle game at a health system, or if you're not and you have a friend that is, like, definitely something you want to share this podcast, share it with a friend. That's how we get the word out on things like this. Don't just sit on it, forward it via text. We're going to post this on LinkedIn. Copy people on LinkedIn. Let's have a conversation about this because it's an important conversation, and we need more companies like iVitaFi to make access friendly, and not trying to make money off of every little thing. Chris, as you guys have built a company, and thinking as entrepreneurs here, it's not always easy. We face setbacks. Can you think about a setback that you guys experienced and what you learned from that, key learning that's made you guys even better?
Sure. I think I'd have to point to the obvious answer here. We launched our offering in the fall of 2019, which was obviously right before COVID hit. And I can promise you, Saul, we did not have global pandemic on our enterprise risk assessment when we were launching.
I can't believe you didn't.
I know, what a miss.
That's so short-sighted, Chris.
That's awful. So, COVID was interesting because it gave us an opportunity to be kind of introspective, because our go-to-market thesis was to go and call on these hospital CFOs and VPs of revenue cycle within hospitals, but realized that they were a little preoccupied, right? So we took that as an opportunity to kind of focus inward and be hyper focused on our product and making sure that the user experience was as seamless as possible. Understanding that there was so much noise and friction in the world, we wanted this to be, as easy as paying for an Uber, right? When, you don't even think about it when you whip out your phone to pay for an Uber. It's that seamless. That was kind of what we had in mind for embedding the financing program within the workflow of the revenue cycle. Additionally, we expanded our scope and started focusing on ancillary healthcare services too, outside of hospitals, because there's a lot of healthcare being done outside of hospitals. And kind of as a result of those two things, we've seen triple digit growth every year since.
That's awesome, man.
So it's been an interesting ride for sure.
And when you do the right thing, you solve the right problems in the right way. You're solving problems for all of the stakeholders in that value chain. You're going to grow. And I think this is an important message that we all should be thinking about is what's that network that you're working in, and are you providing value? This idea of every organism in the ecosystem has a role, and the minute that they don't serve a purpose, they get extinct. So you guys are like symbiotic, man, with all of the organisms, and you're having success, triple digit growth. Congratulations. I love hearing these types of growth stories. Chris, my pleasure. Look, leave us with the closing thought. What do you want us to be thinking about? And for anybody listening to this that you want to connect with, that you want to learn more about you and iVitaFi, where can they find you? So take away, and where can they find you?
Sure. So I think I'll leave the audience with kind of my thoughts on where the industry is going. Which is, I think the fancy or the trendy answer would be like, oh, it's AI, right? Because AI is now the flashy buzzword for, it's the answer to every question. I actually don't think healthcare is ready for AI yet. And there's more of a digital transformation that's needed. And the story that I like to tell, I was traveling for work a few years ago. I found myself in Denver, Colorado. And I was, it was one of those, I was on a campaign, right? You wake up in the morning, you don't know which, state you're in. And I'm checking into the hotel. It was a Marriott property. And I see Kayla at the front desk, and she's nice, but not overly nice. I get checked in, you could tell she may not have been having a good day. I get up to my room, I take out my card, I let myself in the room, and my phone pings. And it looks like I had a text message, and I look at it, and it's Kayla. And she's saying, hey, I hope you have a great stay. Please text me if you have any questions. We're happy to have you, with a little smiley face. And I'm like, oh my gosh, it's so kind. And it hit me. It wasn't Kayla. She's having a bad day. Like, this was all automated, right?
Yeah.
It was all automated to say the register at the front, insert their name. And as soon as I swipe my card, send me this text message. And it's like, why can't we have more of this in healthcare? It is really this digital transformation that needs to continue to occur. I think about, healthcare, we avoid having conversations around, price transparency. We avoid conversations altogether. Most of the communication is done either over the phone or using paper billing statements, which that's antiquated now. So really taking this digital first perspective and being laser focused on the patient experience is where I think we need to go. And then once you have that bedrock kind of figured out, then you can start to layer on AI on top of it to then improve it.
Well said. Well said.
So that's what I'm excited to, continue to monitor and watch in healthcare. If anybody wants to learn more about our company or me, you can contact me on LinkedIn. If you search for Chris Cox, there's probably 500 of us out there. So search for Chris.
We'll put the right one. We'll put the right one in the show notes. We'll put the right one in the show notes. Yeah.
Perfect.
And then the website probably, right?
Yep.
You want?
You go to our website, iVita Financial, iVita financial.com. And you can follow us there too.
Amazing. Well, Chris, thank you. This has been informative, insightful. Love the work you guys are doing. Love your entrepreneur story. And for all the listeners out there, man, there's pearls of wisdom in our chat with Chris today. not only from a rev cycle management, but also from a business development standpoint. So definitely one I would re-listen to and take some notes on. Thank you all for tuning in. Stay tuned until our next time. But until then, Chris, we want to thank you for being with us.
Sure thing, Saul. Thanks for having me.